Hi Miss, today I will talk about benign prostatic hyperplasia and commonly known as BPH. The BPH is one of the most common conditions affecting the male reproductive system, especially in older men. What is benign prostatic hyperplasia? It's a non-cancerous enlargement of the prostate gland and commonly affects men. The enlarged prostate can compress the urethra and interfere with normal urination. BPH is one of the most common urological conditions in older men. What is the anatomy and function of the prostate? The prostate gland have a small gland located below the bladder, surrounds the urethra, and the function is produce the fluid that nourishes and protects the sperm. It plays an important role in male reproductive health. The prostate plays an important role, and the exact cause of BPH is not completely understood, but is strongly associated with aging and hormonal changes. The main risk factors include the risk and factors include age-related and hormonal changes, old age, increased activity of dihydrotestosterone (DHT), and risk factors like over 50 years and family history with BPH. And other factors are obesity, DM or diabetes mellitus, cardiovascular diseases, and sedentary lifestyle. The pathophysiology. The pathophysiology. The prostate cells gradually increase in number. The enlarged gland compresses the urethra. The urine flow becomes obstructed and it contains in the urethra. The bladder must work harder to empty, and this starts to change the epithelium of the urethra. The result is a lower urinary tract symptoms. Let's what is the symptoms and clinical manifestations? Voiding symptoms are weak urinary stream, difficulty starting urination, intermittent urine flow, straining during urination. Distorted symptoms are the increased urinary frequency, urgency to urinary, nocturia, frequent nighttime urination. The complications are acute urinary retention, bladder stones, hematuria, kidney damage, in severe cases, reduced quality of life. The diagnostic begins with a medical history and physical examination. One of the most important examinations is the digital rectal examination, which allows the physicians to assess the size of the prostate. Additional tests may include urinalysis, prostate antigen PSA testing, ultrasound studies, and uroflowmetry to evaluate urine flow. The first is the historic clinical and the physical exam with a digital rectal examination. If doesn't confirm the diagnosis, you can do some studies of image like ultrasound or uroflowmetry or something laboratory test like prostate specific antigen testing. What is the treatment? Alpha blockers like tamsulosin. It works in alpha 1 adrenergic receptors, alfuzosin, and 5-alpha reductase inhibitors like finasteride, dutasteride, and lifestyle modifications, control the diabetes mellitus, do more exercise, reduce caffeine and alcohol intake, limit fluids before bedtime, regular physical activity. And finally, surgical management. used when symptoms are severe or complications occur, like resection of the prostate, transurethral, and laser therapy, and minimal invasive procedures. Thanks.